Hi, my name is Richard Meza, and this is my Who Am I Now reflection as I complete the CBU Con nursing program. Throughout this program, I grow into a nurse who prioritizes safety, following procedures with intention and approaching situations with critical thinking. At first, I didn't fully understand how important every step is, but now I understand that even the smallest detail like verifying patient information or maintaining sterile techniques can make a major difference in patient outcomes. I learned to slow down when needed, double check my work, and stay mindful of how my actions impact others. I've also developed stronger clinical judgment. Instead of just completing tasks, I now think about reasoning behind them and try as well as doing cluster care. I ask myself what could go wrong, what signs I need to watch for, and how to respond if something changes. This mindset has helped me become more aware and proactive in different situations. Another major area of growth has been teamwork. I learned how it is important to communicate clearly, support coworkers, and step in when help is needed. Healthcare is a collaborative environment, and being dependable and respectful makes a difference not only for the team, but for the people we care for. Overall, I become more detail oriented, holding myself accountable on my actions, and intention on and how I approach each of my actions. I now see it as both a science and a responsibility that requires constant awareness and effort. When first started the program in CBU, I was honestly very nervous and unsure of myself. My nursing knowledge was very limited, and I often felt left behind compared to some of my peers who already had some experience in the healthcare industry. That made me question myself whether I was capable of succeeding or not. I was especially worried about not passing due to the required test and quiz averages, where the exams and quizzes felt overwhelming, and I struggled at times with ATI because I didn't fully understand how to break down the question or apply what I was learning. It kind of became to the point where like I struggled to get like level 2. Usually I get like level 1 saying doing retakes. It felt like I was trying to learn a completely new way of thinking, especially when ATI is much more harder than the Eclipse Excel from what I heard. Over time, though, things began to change. I started adapting to the mindset of a nurse, focusing less on memorizing and more on understanding. I learned how to approach questions more critically, recognize patterns, and connect concepts, different concepts that can connect together. As I progressed, my confidence was slowly improved. I became more comfortable in both the classroom and clinical settings. I also developed better ways to manage stress and stay focused during challenging moments. Looking back, I can see a big difference in who I was then compared to now. I've grown not only in knowledge, but confidence, resilience, and ability to trust myself in this role. Throughout this program, I developed a deeper understanding of how a biblical worldview influences the way I approach nursing. It reminded me that caring for others goes way beyond physical needs. It involves showing compassion, patience, and respect in every interaction. Seeing individuals through this perspective helped me recognize the importance of treating everyone with dignity, regardless of their circumstance. It also challenges me to remain calm, kind, and understanding, even in stressful or difficult situations. One verse that really got me throughout this journey is, "I can do all things through Christ who strengthens me," from the biblical verse of Philippians 4:13. This verse means a lot to me, especially during moments when I feel overwhelmed, stressed, or doubt my abilities to the point I feel like throwing the towel. It reminded me that my strength doesn't come from myself alone, but from my faith. There were times where I felt mentally and emotionally drained, but reflecting on this verse helped me push forward and stay grounded. It gave me reassurance that I was capable of overcoming challenges, even when things felt uncertain. Moving forward, I plan to carry this perspective into my practice by continuing to show empathy, patience, and a genuine desire to serve others, while relying on my faith during both the good and difficult moments. During the nursing program, we were introduced by the author Parsi of and her book The Theory of Humankind. The theory of human becoming has helped me has helped shaped how I view individuals in my care by emphasizing that each person has their own unique experiences, values, and understanding of how others, as well as their own backstory. This theory goes beyond focusing on the diagnosis. It encourages me to see the person as a whole, including their thoughts, feelings, and personal beliefs. It taught me that what matters to one individual may be completely different for another, and that those differences should be respected. In practice, I plan to apply this by taking the time to listen more carefully and understand what is important to each person. Instead of assuming what is best, knowing what's best for the patient, I want to involve them in decisions and support their choices that align with their current values. This approach builds trust and creates a more meaningful connection, allowing care to be more individualized rather than one size fits all. What sets this apart, I won't just focus on treating a condition, I'll focus on understanding the person's perspective and supporting them in a way that reflects their goals and preferences. This series has changed how I think about nursing itself by reminding me that every interaction matters and that truly listening can have a significant impact for both the nurse and the patient. The most meaningful impact part of this program for me was the clinical experiences. Being able to shadow each of my nurses gave me a real understanding of what the role looks like on a day-to-day basis. I was able to observe and participate in documenting care, checking vital signs, performing safety checks, and understanding how nurses manage multiple responsibilities at once. I also saw what happens during high-pressure situations like a code blue or code gray, and the importance of teamwork and quick decision-making in those moments. In addition, I experienced interactions with patients and their families, including situations involving emotional stress, difficult conversations, and even aggressive behavior. I also saw firsthand the challenges nurses face, such as understaffing and heavy workloads. These experiences show me that nursing requires not only knowledge and skills, but also patience, adaptability, and strong communication. The most important takeaway I will carry with me is to stay aware, remain calm under pressure, and always prioritize safety while supporting those around me. I am truly grateful for CBU, my professors, and my classmates for giving me the opportunity to learn the ropes of being a nurse. This program has opened my eyes to how much responsibility and dedication this profession requires, and I now understand that there's so much more to nursing than initially thought. Today, I can confidently say that I've grown into a more capable, resilient, and compassionate nurse. I'm ready to continue learning and take on the responsibility of this profession, and I'm prepared to move forward on this journey once I graduate from my school and take my NCLEX, and once I pass my NCLEX, become a fully registered nurse ready to get into the business. Thank you for listening to my reflection.